Obesity, the hidden battle of protecting your bones. While the entire world grapples with the rising tide of obesity, a lesser known yet critical aspect comes into the spotlight: bone health. I am your host and host, Dr. Sargam Soni, and welcome to this episode of Health Point. Obesity leads to a chronic inflammatory state in the body, which can be really detrimental to bone quality. However, the type of fat, especially visceral fat, is a key factor. This kind of fat is metabolically active and secretes substances that may negatively affect bone health. Today, as we delve into pressing health concern in India, the rising trend of obesity and its implication, we are joined by none other than Dr. Girish Mathur, the President of the Association of Physicians of India, to discuss the significance of bone health in managing obesity. Welcome back to our show, Dr. Mathur.
Thank you, Dr. Sargam. It's a pleasure being here this morning.
Dr. Mathur, as we see, obesity is quite an alarming and rising trend in India. How does obesity affect the bone health? Would you please shed some light on it?
It's an important aspect. While it is common misconception that more weight means stronger bones, the reality is quite different. Obesity can lead to chronic inflammatory state in the body, adversely affecting bone quality. And despite having higher bone density, obese individuals have a greater risk of fractures, particularly in the hip, wrist and spine.
That's quite a paradox, doctor. Now, could you please explain us about the role of nutrition, especially calcium, in such people who are obese and we want to maintain their bone health?
Yeah, absolutely. Calcium is critical nutrient for bone health. It is the building block of our bones and teeth. A diet rich in calcium helps in the formation and maintenance of strong bones. However, the Indian diet often lacks adequate calcium, which can lead to bone-related issues, especially in the context of obesity.
What is your take on exercise helping in improving bone health?
Exercise plays a vital role. Weight-bearing exercises such as walking, jogging, and strength training stimulate bone formation and increase bone density. For obese individuals, starting with low-impact exercises like swimming or cycling can be beneficial. It's not just about losing weight, it is about improving overall bone health and reducing the risk of fractures.
Okay, so now we know that it's a combination of diet and exercises that is really going to help you improve your bone health. Now my question is, doctor, are kids and adolescents also falling into the high-risk category in case if they are obese?
Unfortunately, yes. The trend of obesity in children and adolescents is rising in India. This is crucial age for bone development. And poor nutrition and lack of physical activity during these years can have long-term effects on their bone health. Encouraging a balanced diet and a regular physical activity is very essential.
Thank you, Dr. Mathur, for shedding light on such an important topic. And now, let's see what the other doctors have to say.
Obesity actually induces a chronic inflammatory state in the body, which can be detrimental to the bone quality. Healthcare policies must evolve to address both obesity and bone health in a more integrated manner. Recognizing the interplay between these two critical aspects of health, as India grapples with the growing challenge of obesity, understating and addressing its impact on the bone health becomes increasingly important for the overall well-being of its population.
Despite the higher bone density often associated with obesity, there is paradoxically increased risk of fractures, particularly in the weight-bearing bones. An holistic approach that includes dietary management, physical activity, and lifestyle changes is essential for improving bone health in obese individuals, ultimately contributing to the overall well-being and quality of life.
Thank you for deepening our insight into the matter. Calcium plays a pivotal role in maintaining bone health, especially in the context of obesity, where the risk of bone-related issues is heightened. Ensuring adequate calcium intake, whether through diet or supplements, is absolutely crucial for strengthening bones and mitigating the adverse effects of obesity on skeletal health. That's all for now. This is your host and host, Dr. Sargam Soni, signing off for now. See you tomorrow. Till then, swasth raho, mast raho.